welcome to the sponsor room. Thank you to Lumenis for being here, for supporting Woo You and for supporting this series. If you haven't signed up for the other webinars in this series, please do so because you're going to learn so much. But I am excited to have Stacy Winter here from Lumenis. Stacy, I will turn it over to you, but I'll be in the background. So if there are questions that do come up, please enter them in the chat or the Q&A, just like in the webinar, and I'll either let Stacy answer them if she wants on the fly, or afterwards I can facilitate some Q&A for you as well.
Perfect. Thank you, Dr. Stewart. And thank you for the time here tonight. We at Lumenis have been longstanding partners in optometry and certainly big proponents and advocates of education. So no finer place than Wu University to share a little bit more about OptiLIGHT and this unique solution as you're considering incorporating it into your practice. So a little bit more about Lumenis. You may have just most recently learned about Lumenis within the last couple of years as we launched OptiLIGHT, but we have been around for over 60 years, and we've been longstanding partners within optometry and with eye care, and innovators as well. So we developed the first photocoagulator, we invented the first YAG and SLT, and you can see there in 1993, that is when we invented IPL. So IPL is not new, it's new to optometry and new for dry eye disease, but it has been around for 30 years. And with that innovation, we feel like we've perfected it. We are currently on our 7th generation, and in 2021, we launched OptiLIGHT, which is the first and only FDA approved IPL for dry eye disease. And I want to expound upon that a little bit more, but preceding that, and also perhaps relevant to what you might be considering within your practice, is we just launched the new digital duet in Trio as well, which is our combination SLT YAG laser, and big proponents of optometry, also big advocates for scope expansion. And so you'll hear more about Lumenis as that might be something that your state is considering or you yourself are looking at incorporating into your practice. But that's a conversation for another day. Tonight, we want to talk about OptiLIGHT. So why dry eye disease? Why the focus? Why get the indication for dry eye disease? Because we know that 49 million Americans are affected by dry eye disease, and it represents roughly 40 to 45% of the patients that come through your practice. And hopefully through is not the right descriptor when describing what transpires with these patients, but we know that patients see 3.2 practices before they find a doctor who's able to effectively treat their condition. 80+% are frustrated by their condition. They wish there was something more they could do. And in fact, these patients are spending in excess of $1,300 on an annual basis on out-of-pocket over-the-counter expenses and not getting the relief that they're looking for. And dry eye disease doesn't happen in a vacuum. This isn't a singular condition. We know that it is highly common across a number of different medical conditions, including glaucoma. 59% of glaucoma patients have dry eye disease. As you think about the drugs and drops that are required in order to treat glaucoma, that's very disruptive to the ocular surface and creates a dry eye disease and can impact compliance of that very necessary prescription. Simultaneously, 50% of contact lens wearers suffer from dry eye disease. You see a lot of contact lens dropout because of it. So we know that dry eye disease is very common in all of these conditions that you're seeing. And it's also more recently becoming popular for pre and post-surgical care. So if you're referring out for LASIK or cataract, this is a treatment that we know enhances surgical outcomes as well. So dry eye is everywhere. We talk about this being the first and only light therapy, IPL or otherwise, that's been FDA approved for dry eye. And I wanted to expound on that a little bit because I think we take that at face value when we say FDA approved means safety and efficacy, almost exclusively. And while safety and efficacy are certainly a key component of it, it is not the only thing that plays into an FDA approval. We actually received the de novo approval, which means it's the first of its kind. There's no other device that has been proven to effectively treat dry eye disease the way not IPL does, but the way OptiLIGHT does. So I want to get into some of the components of how OptiLIGHT works differently than other IPLs that might be in the market, that might be FDA approved for some of your classic dermatological conditions, but not dry eye, and why that matters to your practice. So yes, it ensures you have patient safety first and foremost. You're going to get efficacy, but efficacy in delivering real medical results. The difference for an FDA approval for dry eye disease, as OptiLIGHT has, is that we guarantee you're going to be delivering a medical result, not a subjective cosmetic enhancement. And those things are different. OptiLIGHT is designed with very intuitive presets, which make it easy to incorporate into your practice. We have ergonomic handpieces that are designed exclusively for you, eye care providers. And having that FDA indication does something very special too. It allows you to market more effectively to your patients, and it allows us to help with patient awareness and education and thereby drive them into your practice. So it's not just about safety and efficacy, but it's in the confidence and care that you're going to be delivering to your patients. I mentioned we have over 50 clinical studies. Here's a snapshot of just 21 of them. There are many more, and certainly available for your review if you want to go a little bit deeper into the science of how OptiLIGHT works. We know that OptiLIGHT is a great treatment for dry eye disease because dry eye is a multifactorial disease. It's progressive, it's chronic, right? And we need a multifactorial treatment for this multifactorial disease. So OptiLIGHT does a lot of different things. One, it decreases the level of pro-inflammatory mediators. I'm sure Dr. McGee covered all of this. It does that by alleviating all of the abnormal vasculature that releases those mediators. It decreases Demodex, right? You don't know this, but it kills Demodex on the spot. The way that it does that is the way that the energy is released is it's diffused and it's absorbed by the exoskeleton of Demodex. It kills them on site. It restores the meibomian gland morphology, chronic and progressive. This is something that can actually not only stop it, but help restore that gland morphology, and it increases tear breakup time. So lots of great attributes here that accompany OptiLIGHT, not to mention the boosting of collagen that is phenomenal for some of those aesthetic and cosmetic improvements. So the way that it works, you can see here the abnormal vessels releasing those pro-inflammatory agents. We can treat that by not just treating the eyes, but actually treating tragus to tragus. So this is a skin gland disease, and because of the vasculature around the periorbital area, applying OptiLIGHT to that area with the light diffusing will actually break up that vasculature and eliminate those pro-inflammatory mediators. When you start looking for inflation or for rosacea, you will see it everywhere. Here's some abnormal telangiectasia on cheeks, on the nostril, on the eyelids, and the lid margin. And so once you know what to look for in terms of rosacea, you will see it everywhere. And this is what OptiLIGHT targets in order to really treat that root cause of inflammation. So what's unique about OptiLIGHT for dry eye disease? I said I would expound on this above and beyond just any type of IPL out there. And what's unique about the internal makeup of OptiLIGHT is that it comprises these 5 things. And this is important in order to be able to effectively treat dry eye disease, giving you a medical result, not just a subjective cosmetic improvement. So 1, you have to have the right wavelength. 2, the right energy. 3, the right pulse train. That means the right time on and off of tissue and the energy being applied in the right location. So let's dig a little deeper into some of these aspects. So 1, the right wavelength. The way that IPL works in general in OptiLIGHT is that light is emitted, it passes through a filter, and it cuts off the undesired wavelengths. So we want to target melanin and hemoglobin, reds and browns. And you do that by selecting the right filter in order to treat that inflammation. We know that it's a 590. 590 is going to be the best filter selection in treating the rosacea and the abnormal vasculature around the eyes. Now, we have a number of different filters that are available, and each of them works by targeting different depths and different chromophores across the face. So it's important that you have the right wavelength, the 590, when you're treating dry eye disease. The other thing that's important is that you have the right energy for dry eye. We know that's between 10 and 16 joules per centimeter squared. And there's a lot of complexity that goes into designing an IPL if it doesn't have the presets automatically uploaded and embedded for you when selecting the right treatment for your patient. So you can see here 2 different treatment screens that are available on the OptiLIGHT. So one is for our larger handpiece, IPL, and that's the larger fuller face treatment of tragus to tragus. So you simply select the patient's skin type. skin types 1 through 5 can be treated for dry eye disease, and it will automatically preset the right energy level for you, as you can see here. If you move into the smaller OPT handpiece, again, you select the appropriate skin type and it will automatically default to the right energy setting. So there's no guesswork as far as what's the right energy and what's the right setting for this patient with their dry eye disease condition, because those embedded settings, the intuitive design, make this very easy for you to use and have confidence when incorporating into your practice. The other component is the right pulse structure. Energy can be delivered in a number of different ways, and we have what's called our patented optimal pulse technology, OPT, you'll hear it referred to. And what this is it means you have no spikes. So you have a consistent top hat of energy, meaning the energy you select is the energy that you are going to get, and you can be very confident in that energy delivery. The other component is that we do have a patented triple pulse technology. Now, this delivers the energy into smaller packets, and that gives you maximum effect and comfort for your patients. So when you're talking about breaking up the abnormal vasculature around the eyes, one, it's a very sensitive area, so you want to be careful not to have any type of thermal damage. So energy selection is very important, and also how you're delivering that energy as far as the pulse is critical. And so energy delivery in simplest form, if you were to punch hard, that's a certain amount of energy. But if you were to break that up into 3 smaller pulses, the same amount of energy is being transferred, but one of those is a whole lot more comfortable and a whole lot more effective over time as well. And that's what the triple pulse by Lumenis does. And that's why you get a result unlike any other that you would see in the marketplace. It's important that you have the right time on and off of tissue. Our pulse duration is 6 milliseconds on and 50 milliseconds off. That gives you the right time to treat the vasculature and allow the tissue to have some thermal relaxation as well. Now, what that looks like in action, pictures are always better than words. And so I wanted to show you how we can effectively target and treat hemoglobin while not affecting any of the tissue around it. So this demonstrates that you can destroy red without causing any destruction to the non-targeted chromophores. Even more impressive, this will show you how targeted it is, and the fact that it doesn't impact the blue, because that's not the chromophore that the filter is selecting here. And lastly, in regards to how our system is different than anything else you'll see on the market, is we give you access to the right location. Again, OptiLIGHT is designed specifically and exclusively with eye care providers in mind. And so we've taken a couple of different measures. One, on our larger IPL handpiece, we've equipped it with elongated light guides, which give you great visibility and coverage, unlike anything else in the marketplace. We know it's important that you get close to critical structures without touching them, and this gives you the ability to see exactly what you're touching. Simultaneously, this OPT handpiece is much smaller, 6.4 millimeter tip, which allows you to get very close to the lid margins and effectively treat on and around the eyelid. What all of that means together is you are going to get great scientific results. This is clinically proven in this formula to reduce the inflammatory markers involved with dry eye disease. So you can see here, the inflammatory markers have gone down dramatically when you look at tear samples. And on the right here, you will see that we improved tear breakup time from the baseline of 5.8 increasing to 11.2, a 91.3% increase during that third follow-up. So some very impressive medically backed statistics here about what OptiLIGHT can do for your patients. When you look at the gland morphology, we talked about restoring the glands, and you can see before and after IPL here on the left, and that their structure is much more intact. And the number of expressible glands is also important. You can note the difference on the right of a control group versus those who have undergone OptiLIGHT by Lumenis. Not only are there great internal scientific benefits to what's happening in your lid margins, with your glands, but your patients will feel and look better because of OptiLIGHT. It's amazing the before and afters that we see. There are visible improvements, and aesthetics is the side benefit, right? We typically talk about side effects of a medication or a treatment, but this is a side benefit that you get, is that you're able to treat the dry eye disease and give your patients a great appearance as they're coming out your practice. And we know that that's great for retention as well. If you wanted to upgrade and do additional aesthetics, we have that option available at Lumenis as well. So you can see a number of different before and afters. Our aesthetic upgrades involves a software and hardware change. And you have the ability to treat melasma, acne, hair removal. You can get into resurfacing if you would like to. There's a number of different things that this device can treat. But if that's a pathway that you want to explore in your practice, these are things that can be added later as well. We're here as a modular system to grow with your practice and operate in a way that's most comfortable for you. OptiLIGHT integrates very easily into your workflow. We find that treatments typically take somewhere around 15 minutes from start to finish. That includes the prep time by a technician. It's a series of 4 treatments spaced 2 to 4 weeks apart. It can be followed by expression, your personal choice. And we frequently see patients come back for maintenance treatment somewhere between 6 and 12 months. And a lot of that has to do with how they look and feel, but also they really enjoy the benefits that they start to see because of IPL, not only on their eyes, but on their face as well, as you're naturally cleaning up the reds and browns along the way. From an ROI perspective, typically we're seeing across the country 4 treatments are required for a patient. General charges somewhere between $1,200 and $1,600. If you were to incorporate this into your practice, you could expect that same type of revenue on an hourly basis. So from a financial perspective, this is a great business model. Not only are you delivering phenomenal patient care, but it's an opportunity for you to keep those funds within your practice. We mentioned previously that patients were spending $1,300 out of pocket over the counter at the pharmacy. This isn't asking patients to spend any more money than they already are. It's simply requesting that they keep that within your practice to provide an in-office treatment. And we know this day and age, patients are looking for instant gratification. We live in a fast-paced world. Daily drops in compliance isn't a pathway that everyone wants to pursue. And this is a great way to knock something out very quickly. Simultaneously, from a revenue perspective, we know that ROI is typically seen within 60 patients. So as you're thinking on a weekly basis about the number of patients that you see, how many of those are dry eye patients? How many of those do you think would be interested in exploring a different treatment regimen than they already are? So we see a majority of our devices are paid off within 3 to 6 months, and you can see the ROI thereafter based on how many patients you might be moving into this treatment on a weekly and monthly basis. So we've talked about the clinical efficacy of this, the financial benefits, the operational efficiency, and everything that coincides with your practice because this is an FDA approved device for dry eye disease. But the one thing that we haven't talked on that perhaps is most important is what it looks like for marketing support for you. One of the great things about having the indication, as I mentioned, is the ability to promote dry eye awareness to a patient population that is undereducated about this disease state. Many patients don't know what they're suffering from. They think it's something that they have to live with, and we want to better educate them to the options that they have available. So we at Lumenis have partnered and gone direct to consumer to help drive patient awareness in this front. With the purchase of an OptiLIGHT, we also provide practice marketing and implementation support, a number of things to advertise this treatment offering within your practice. And we also have a unique relationship with marketing for ECPs, which is a third-party company that specializes in marketing, so that as you're incorporating this new in-office treatment, that you can update your website. Promote it on social media. So this is a way to advertise to your current patients and attract new patients to your practice, alerting them to this great new technology and treatment that you're offering. Simultaneously, we have a practice locator map. at our special website, Treat My Dry Eye. This is a place that houses all of the practices that are incorporating OptiLIGHT, and we receive over 180,000 hits on a monthly basis for patients who are looking for a place to go to learn more about where they can get a treatment near them. So this is another useful tool in bringing people to your practice. We have additional resources on top of that. We do have a website called Partner Zone. This is a hub built exclusively for our doctors who have invested within OptiLIGHT, and it stays updated with all of the latest and greatest information that you would want to know in order to make OptiLIGHT run more effectively within your practice. So what that includes is access to pre-printed marketing materials or materials that you might want to add your logo to. You can order those directly and access those. Waiting room videos to advertise again to your patients. We also have digital kits, which include social media posts and email banners, website banners, ebooks that talk about practice growth. This is where you can view all of our clinical studies and publications. And we also have ongoing training that's available here. So OptiLIGHT videos on how to use if you have staff that's new to your practice or you want a re-education on how to best use the device. This is a great place for you to visit as well. And lastly, we do have a Vision Resource Hub for on-demand recordings. If you like webinars, and you do, you're here at WooU, we have got one for you as well. So Lumenis Vision has a destination where you can go and listen to all of the past webinars for education that's been conducted regarding OptiLIGHT and implementing into your practice, and even deeper dives into all things clinical. So here's some additional resources. We are packed with ways to support you in your practice as you're thinking about incorporating this new in-office treatment. We know that confidence is key, and we certainly have invested heavily in a number of different resources to ensure you have exactly what you need to confidently incorporate this technology into your practice. So why OptiLIGHT? Because it's the first and only FDA approved device for dry eye disease. It's an opportunity to exponentially grow your business while providing phenomenal patient care, breaking the dry eye vicious cycle of inflammation. It's easy to integrate into your workflow. It's upgradable, and we at Lumenis have been invested in optometry for more than 60 years, and we will certainly help you and your practice get this incorporated at a very fast and easy pace.